Welcome, Welcome, Dr. Emily, and thank you for sharing your knowledge and participating with this program. So I have followed your many webinars for going on 5 years now, impressed by your scope of applicable and functional knowledge when it comes to the foot and ankle. How did you go from being a podiatrist to a functional foot specialist? And what is a functional foot specialist?
Yeah, so my journey through fitness and movement is actually kind of flipped sometimes. That I started in the fitness industry and had a huge passion for movement, as I think a lot of fitness professionals do, because we are training movement. We spend a majority of our days assessing and creating programming around movement. Then I went to podiatry school and I started to see the disconnected methodology that I was being taught. And because I had the background in fitness, I was like, this doesn't seem right. This is not settling well with kind of my philosophy and how I know we need to look at movement. So fast forwarding, as I continued my podiatry journey, went through surgery training, residency, all of that stuff, it became more and more disconnected from the body. So I actually took a pause from my residency training, went back to school and got a master's in human movement. And that's where I studied really the integration of the foot with movement, barefoot science, advanced biomechanics from like a joint coupling integrated perspective. And then I applied what I appreciated as a fitness professional, what I learned as a doctor, a foot doctor, and then what I was now learning as a movement specialist. And then I interwove all of them to then really create what I do today, which is more functional podiatry, or I look at functional movement from the ground up. And I really hope to teach other professionals about how integrated the foot is from an integrated perspective. And then I also really want to help the podiatry community, the next generation of podiatry, to appreciate what all of the listeners already appreciate, and to hopefully change them that it's not this disconnected. The foot is over there, the knee is over here, the shoulder's there, but they're obviously all connected.
Well, this is quite an undertaking for someone to do. And you're a new mother. You have a 2-year-old. That's a lot of work to do, but go for it. And thanks. Anyway, so let's move to the next step, which is, as a barefoot movement specialist and a promoter of it, you come from the ground up, so to speak. So please explain for our participants how the foot leads all the way to the core. And I'm going to interrupt myself here. I was at the NSCA conference last month and heard your program there, and it was like, wow, duh. We always hear about the ground up, and if anybody's been reading about barefoot science, they get a sense of it. But the connections you drew were like new lines, so to speak. So take into account the in discussing barefoot movement, take into account the mechanoreceptor density of the skin. I believe it's the glabrous skin, a word that you introduced me to as well, into the fascial lines and all the way through the hips and up into the spine and beyond.
Yeah. So our feet are really interconnected. That's what I was kind of referencing as what my journey has.
Lost a little sound here. Uh-oh. Is your connection good there? Can you hear me?
Oh, no.
Oh, there. Okay. You're back.
Okay.
All right.
I don't know what happened.
No do I, but that's okay. They're getting the whole recording.
Okay. All right. So that is what my journey has been so far. And now I'm trying to share that with other professionals. The way that I look at the foot in how it's connected to the rest of the body is from a biomechanical perspective. That's the joint coupling that I had mentioned briefly, to a sensory side, and then a fascial perspective. So those are the three ways that I respect the foot, that the foot is integrated with the rest of the body, the core, the hips, the pelvis. I would say the mechanical is the most well understood. It's what a lot of people first think about when they think about the foot is pronation, supination, inversion, right? So all these movements that are, one joint influences another joint. And that's where you could say that if someone has a flat foot or they're pronating, they rotate inward. It's the couple of pronation is that you internally rotate. And what does that do all the way up into the hips and the pelvis? Oh, okay, it destabilizes it and it makes it harder for the deep core to engage, for the glutes to engage. So if I have the opposite foot type, which is more higher arch, neutral, or inverted, that's coupled with more external rotation. External rotation favors a more externally rotated, engaged glute apparatus. So we can start to see, okay, how foot type mechanically can influence power into the hips and stabilization into the hips. Mm-hmm. Now, from a sensory perspective, that is the glabrous skin that you referenced. That is how the skin in the bottom of the feet has very special nerves, nerves that are sensitive to different stimulation. And these nerves are continuously reading the ground. So every step that we take, I often say that every step is different. No two steps are exactly the same, which means our nervous system has to be able to read the ground and adjust, auto adjust for each step. And the auto adjustment that I'm referencing is stabilization, loading response, energy transfer. So a lot of stuff that is really important for dynamic movement and power and performance. So these nerves in the bottom of the foot, we can access them through different techniques, such as minimal shoes, getting out of the cushion to allow those nerves to be stimulated, help someone connect to their feet, their foundation, their movement, and their nervous system. Another way is that barefoot training, right? Actually get out of your shoes and access these nerves by being on different surfaces. So all surfaces provide different information to the nervous system, where I often will say harder surfaces are better than soft. So thinking like a group exercise studio or a basketball court, where it's the hardwood floors that are often suspended, those are perfect for stimulating the feet and the nervous system. This is where vibration, so whole body vibration platforms are really good because they stimulate the nerves in the feet, and then that communicates with the body to control movement. And then the final one is going to be texture, which is Naboso. And that's actually why I developed Naboso. And for the listeners who are not familiar with Naboso, it's a sensory product line that includes flooring, mats, insoles, release tools. We have socks that are coming out, and all of them have a texture, a 2-point discrimination pattern to them to stimulate these special nerves. Now, Naboso, hardwood floors, vibration, minimal shoes, all are a great way to connect to the small muscles of the feet, which are connected to the small muscles of your core. Now, they're connected through what's called a muscle synergy. So there's this co-contraction that's built into the nervous system that is between the foot muscles and the pelvic floor, specifically your big toe. So when your big toe pushes down into the ground, which is your flexor hallucis longus, pushes down, there's research, so fMRI, so showing brain scans, that the part of the brain associated with the posterior pelvic floor engages. So this connection, and functionally where we use that is when we walk. So when you are pushing off and you're about to take a step, you're flexing and pushing your toes down into the ground to release power. To release power, your core has to be stable, and that's built off of the pelvic floor. So that's going to be the sensory way. And then the third and final way is going to be fascia. So fascially, your feet are connected to the core by your deep front fascial line. And that fascial line runs from the tips of your toes through the bottom of your feet, the back of your calf, through your adductors, your pelvic floor, your diaphragm, up to your neck and your pellet. So through these fascial lines, you can connect your foot stability by pushing your toes down, lifting your pelvic floor, exhaling to engage your diaphragm, and bringing your tongue into your pellet. So those are three really powerful ways that your feet are connected to your core for power, for stability, performance, fall reduction, many, many applications as far as how they're connected and why I think professionals such as those that are listening really do need to pay attention to the feet.
All right, that brings in a whole new list of questions. So let's start here. So for us fitness pros, we can't always encourage barefootedness. There's a variety of reasons. Oftentimes in the work environment, if it's a public gym or even a studio, getting some people to take their shoes off, there's embarrassment. Some older people, the fat pad on their feet are gone and they may not feel comfortable doing that. Um, so how can we incorporate what you had just described, uh, foot mechanics and shoe wearing into our program design? I mean, what can and should we do to help our clients when they're shod or minimally shod?
Yeah. So that is a really good point, and I'm glad that you brought that up because there's this ideal that I spoke about. That's the ultimate goal that I would love every trainer to get their clients to do. And then there's the reality
Yeah,
over
right.
here, which is, the client might not be interested. The client is scared. They had a history of foot pain. They have fat pad atrophy, like they said, or you're in a facility that doesn't allow it. So what I often say is, okay, where can we meet in the middle? Meaning potentially could we warm up barefoot? Could you go in a yoga studio or into one of the studios or a corner of the facility and do some movement prep barefoot? Okay. Could we take off our shoes and at least release our feet and then put our shoes back on and do the rest of the movement prep and the session? Could you get them into more minimal shoes versus a lot of cushion and rigidity so you kind of get better footwear? Or, I mean, that's where we put the Naboso insoles as well, is if someone says, this is my shoe with lots of cushion and I have an orthotic, I'm not changing it, say, no problem. Just put this textured insole in to try to connect your feet a little bit more. Could you use toe spacers in the shoes to help them to connect their feet a little bit more? Could you give them cues and maybe do a short tutorial on how to engage the feet and then say, okay, now let's do this in your shoes, but I needed you to first connect to your feet without the shoes, and then we can kind of get back to this compromised position.
All right. Very good. So let's see if I can remember my question. Well, I may deviate a little bit, but years ago, before barefoot science really made it into play, um, there was a lot of conversation in the running community about thickness of soles. And I remember a study, I think it was the medicine and science, sports and exercise from the ACSM. And it was done in Canada, and it was people with plantar fasciitis. And they had them spend, I think, a month just walking outside for 10 minutes a day or something in the grass, barefoot. And they x-rayed them pre and post. And they actually saw the shortening of the foot, just spontaneous, what you're going to, and what one of my questions will be about short foot, just by stimulating the feet in a barefoot manner on uneven surfaces, on unmanicured surfaces. They were able. Now in Canada, you can only do that for a month or two at a time, but I think the point was well taken. I don't know if it's been replicated, but that was brilliant. And then subsequently in the early 2000s, we got the whole science of the barefoot running, um, and the minimalist shoes, right? So that has been part and parcel of the fitness program of late. All that to say, when you, all right, there are two questions on this. So when you do some of these warm-up drills or some specific drills, it's going to be, it'd be really hard for me to remember everything you just described about the fascial, front fascial line and all the way up to the palate.
Mhm.
How far do we have to take it to get the benefit to our client, especially the elderly or those who are at risk of falling? Where does the benefit reach a point where, okay, I'm sorry, I can't explain the groin to you. Where do we go from there?
Yeah. Um, so first, I just want to make a comment on the research study that you had mentioned. I think that that is a great demonstration to the listeners that you can get a benefit to the foot structure without actually doing, short foot exercise that we'll speak about, or doing these really specific targeted exercises. Just moving the way that we move without shoes and make it sensory rich is a great benefit to foot function and to foot strength and to really changes in the foot structure. And there's been other research studies kind of similar that have demonstrated that, wearing minimal shoes such as Vivo Barefoot or Vibram Five Fingers for a period of, 8 weeks, several months, that they noticed a change in the foot structure, the arch height, or hypertrophy of the muscles in the foot. So all of those studies are essentially demonstrating the same thing, that says sensory stimulation has such a powerful benefit to our feet. So I just wanted to kind of add that to the research study that you had said. And then for the question, as far as kind of what can we do? What is this realistic kind of extrapolation of what I'm saying for these clients that's going to help them? And I look at that in three main ways: is releasing the feet. So getting a 5-minute trigger point release of the feet every single day if you can, start of the session. One, you're actually releasing the muscles, so you're giving recovery to the feet. But two, you're tactily connecting the client to their feet, which is really important. If someone is in their shoes, and I know a lot of patients and probably a lot of clients that are in their shoes from the moment they wake up to the moment they go to bed, which means that they, from a tuning in to paying attention to connecting, almost like mind-body connection, they're so disconnected from their feet. And if we're disconnected from our feet on that level, that's going to impact someone's balance and movement. That hands down is going to be a contributor to their fall risk, a strong contributor to fall risk. So can we do some sort of release to the feet? Now, what does that mean to your client based off of their age and their sensitivity? Releasing on golf balls might be way too painful. Not a problem. We don't have to go that way. Could they do a soft tennis ball? Could they do a binky ball? There's so many foot release products on the market. Can we find one that is friendly to our clients' foot sensitivity? And then could we do that every single day and make it realistic, right? I tell people when they brush their teeth, release their feet, kill two birds with one stone. If that doesn't work for the client, maybe when they're relaxing and watching the evening news, they can roll on like a foot log because that works for them, right? So this is the first part. Second one would be doing something from a sensory stimulation that ties to the research, right? So can they walk around their home barefoot, right? I often say, can you get at least 30 minutes a day of barefoot stimulation? Even walking around your home, if that's what it is, perfect. That makes me happy, right? Could we increase that a little bit more to be somewhat at the gym? That would be great. Could you do the Naboso insoles? And that's how you segue to get a little bit more? Great. So what could that mean? So that's another important part of it. And then the third one would be to incorporate, yes, foot exercises, yes, short foot and toe yoga and lift your toes and try to articulate the digits. That's all great. But if we could kind of get the biggest return from one exercise, to me, it would be a balance exercise. So doing something on one leg, And why that has such high foot engagement is your foot plays such an important role in how we balance. So just standing on one leg, you're going to get much higher recruitment of these muscles than if you were doing short foot, 5 repetitions, each side several times a day or something like that. So I try to incorporate things that are functional, and then you get a really high return.
Thank you for making that point. That's excellent, because many of us in the modern world of fitness are incorporating balance drills, but we may not really understand what it does. So you made a very good point there, and that brings me to your Naboso product, which I've tried. Do you need to wear the insole in in a barefoot shoe, or can you penetrate the sock?
Yes, so you can wear no sock or thin socks.
Right.
So you can wear thin socks and you'll feel it.
Got it. Okay. Because I've tried promoting this to some of my elderly clients, and I'll have to try harder, because I do believe the sensory element is crucial if they're willing to participate. So that will be I will have more force now because I can show them this video. So finally, you've taught attendees to your programs online and live, like at the NSCA meeting, the highly beneficial and extremely functional short foot or foot doming exercise. I've used that ever since I've learned it. And I use it around the gym when I'm training clients. I'm doing it. I've told clients who have foot issues, it works. For one client, it worked immediately. But in an abbreviated synopsis, why is this exercise so important and so effective for the foot and up the kinetic chain? You've somewhat addressed that, but maybe if you can be a little more pointed and explain what short foot is without taking your shoes off at the moment, then maybe the participants can get it. And by the way, I'm going to include a video of the short foot exercise in other parts of the lecture. So you don't have to take your shoes off for this. But
Perfect. They're already
okay.
off, but thank you. I'm barefoot in my home. So short foot exercise, for any of the listeners who have never heard of this exercise, it is probably one of the most important foot exercises to understand. I think partly from a historical perspective, because the history of foot strengthening is really based off of Dr. Yanda. And Dr. Yanda was a Czech physiatrist, where he was really the one who came up with this exercise. The way that he teaches the exercise is very different from how you will see it now demonstrated and how I reference it a lot. And the reason for that is because of a lot of the fascial research that has come out the last decade has really opened our perspective to the power of this exercise that at the time that Dr. Yanda was teaching it, that wasn't known. This fascial integration was not known. But short foot exercise from a broad picture is going to be how you activate your foot by pushing your toes down into the floor. Now, that is literally the exercise. You are standing there and pushing your toes down into the floor.
Not curling the toes, correct?
Not curling them, not
Right.
curling them. So I often will tell people, and they'll see in the video when you share it, is find your foot tripod, spread the digits, open them wide, lengthen them out, and then connect the digits, the tip of the digit, like the nail, down into the ground. And just think of it as a lengthen and a anchoring or a connection. So there's no towel crunch, there's no curling, there's no rolling to the side. It's a very lengthen and then just connect. So a way that I'll actually play around with to teach this for people to connect to it, and you can try this if you're listening, you can stand up and do it, or if you're listening to the recording or later, is stand up so your feet are parallel and pretend that you're stiff as a board. And then lean your body forward. So you're just kind of pitching the body forward like this. And as soon as you do that, you're going to feel your toes go down into the ground. It's a postural response or a postural reflex. So as you do that and you feel your toes push into the ground, remember that sensation. Keep that engagement and then center your posture back vertical, but keep the digits engaged. That's technically what short foot engagement is, that action. Now, to take short foot to a functional perspective is every time I teach someone to push their toes down, I need them to engage their core. I need them to lift their pelvic floor, and then I need them to exhale, because we're trying to get that fascial line connected. And toes down, arch lifts, pelvic floor lifts, we exhale, diaphragm lifts, and then we bring the tongue into the palate, and your dome, the palate dome lifts. So we're essentially stacking all of those domes. In yoga, they call them bandhas. So you're essentially stacking the bandhas. So short foot, at first glance, is a foot strengthening exercise to build an arch, like a bicep curl builds strong biceps, versus saying, oh, if you do pull-ups and you do rows and you do these compound movements, you're technically strengthening your bicep, right? So that's how I like to think about short foot. Short foot is not toes down, toes down, toes down. Oh, I just gave my intrinsics an exercise. No, short foot is an activation to your core to prepare the body for movement, and it is an activation technique.
Okay. So in other words, we first teach that, as they have to have that skill before they can move up the ladder, so to speak.
100%.
And that leaning forward is a nice technique. I'm going to try that again tomorrow. Well, I'll try it on me first tonight, but I'll try it on them tomorrow. And to wrap up, another piece to the short foot, if I recall, was that the muscle that is engaged is the tibialis posterior, correct? That's the one that helps to support the arch.
That is the extrinsic muscle that
Right.
is engaged. Yes, and your posterior tibialis is the most powerful supinator / stabilizer of the foot that lifts the arch.
Right. And I will have brought this up in context of foot ankle program module, but there's something that is fairly common among older adults: posterior tibialis tendinopathy, right? And it's a flattening of the arch is what it looks like to some, but to some it becomes a real debilitating condition. That exercise can reduce the impact of that tendinopathy, or can it prevent it?
I would say it would prevent it much more than reverse it. What I will add, just as an aside for all the listeners, is that if someone is having age-related fallen arches, let's say, or it's technically called adult acquired flat foot is what it would be. And it is a post-tib tendon dysfunction, as you had mentioned, right? It's degeneration or it's tearing of that really, really important tendon. And the tendon is just tired, right? And it's just kind of giving way because it's just worked so hard for 60, 70, 80 years.
Then so obesity factors in as well, right?
It does, and hormones as well. So it's actually more prevalent in women, right, postmenopausal women. So, all of that is important for professionals to understand. Right. Short foot and foot to core integrated exercise, in my opinion, is one of the most important preventive strategies for the aging foot, right? Understanding all the risks that happen to the aging foot.
Okay. Well, I thank you so much, Dr. Emily. As always, you present it well and make it seem so easy for us to implement. And hopefully now that everybody's heard you live, they can do it as well. So thank you very much.
Thank you. It was a pleasure.
All right. Good night.